Imagine this. Your country is facing a severe shortage of doctors. Hospitals are understaffed. Rural communities have little or no access to healthcare. Then, suddenly, thousands of foreign doctors arrive and begin providing medical services. During a pandemic, they help save countless lives. But then, the world's most powerful country tells you this program is human trafficking. So, is Cuba's medical mission really a form of forced labor? Or is it the latest chapter in the long-running political struggle between the United States and Cuba? Today, we're taking a deep dive into this complex and fascinating issue. Cuba's overseas medical program is officially known as Cuban medical internationalism. After the 1959 Cuban Revolution, Fidel Castro made healthcare and education top national priorities. The result? Today, Cuba has more than 8 doctors per 1,000 people, one of the highest doctor-to-population ratios in the world. Beginning in the 1960s, Cuba started sending medical teams to countries across Africa and Latin America. Today, more than 24,000 Cuban healthcare professionals work in approximately 56 countries around the world. They provide services in countries such as Venezuela, Nicaragua, Mexico, Angola, Mozambique, Algeria, and Qatar. During the COVID-19 pandemic, Cuban doctors were even deployed to Italy, where their work in the Lombardy region received widespread praise. The program generates billions of dollars annually for Cuba and is considered one of the country's largest sources of foreign currency. The United States argues that the program amounts to forced labor and human trafficking. According to the U.S. State Department, a significant portion of Cuban doctors' salaries is retained by the Cuban government. Critics also claim that participants do not enjoy full freedom while working abroad. In 2024, U.S. Senator Marco Rubio announced visa restrictions targeting officials connected to Cuba's overseas medical missions, as well as foreign government officials who cooperate with the program. The strategy appears clear: to weaken one of Cuba's most important sources of foreign income. For decades, Cuba's economy has been affected by U.S. sanctions. However, after agreements reached with Hugo Chavez in the early 2000s, Cuba gained access to discounted Venezuelan oil. That relationship continued under Nicolas Maduro. But as the U.S. imposed additional sanctions on Venezuela's oil sector, Cuba experienced a worsening fuel crisis. The consequences included daily power outages lasting 6 to 8 hours, disruptions to transportation and industry, growing economic difficulties. This raises an important question. Is the pressure on Cuba's medical missions really about human rights, or is it part of a broader geopolitical strategy? Many Caribbean countries have openly defended Cuba's medical program. Following U.S. pressure, leaders across the region expressed strong opposition. Barbados's Prime Minister Mia Mottley stated in Parliament, "Without Cuban doctors, we could not have overcome the pandemic." Trinidad and Tobago Prime Minister Keith Rowley was even more direct. "I am prepared to lose my visa, but I am not prepared to let poor people in my country die." St. Vincent and the Grenadines Prime Minister Ralph Gonsalves declared, "I will lose my visa if necessary, but I will save the lives of my citizens." These statements raise another important question. If the program is entirely exploitative, why do so many countries continue to support it? In 2013, Brazil launched the More Doctors program to improve healthcare access in rural and remote regions. Thousands of Cuban doctors participated. In 2025, the United States revoked visas for certain Brazilian officials connected to the program. This suggested that Washington's pressure campaign extends beyond Cuba itself and also targets countries that cooperate with Cuban medical missions. There are two very different perspectives on this issue. The U.S. view. The Cuban government keeps a large portion of doctor salaries. Participants may not enjoy complete freedom. These conditions resemble forced labor. The Cuban view. Participation is voluntary. Overseas assignments provide doctors with higher earnings than they could typically make at home. The program delivers desperately needed healthcare to developing nations. The truth may lie somewhere between these two narratives. What is clear, however, is that this is about more than healthcare. It is also about power, influence, and international competition. The United States seeks to reinforce its influence in the Western Hemisphere. For decades, left-leaning governments such as Cuba, Venezuela, and Nicaragua have been viewed as strategic challenges by Washington. Cuba's medical missions are an important instrument of its soft power. These doctors do more than provide healthcare. They also serve as informal ambassadors for Cuba. When a Cuban doctor saves lives in a remote village, positive perceptions of Cuba often follow. That goodwill can strengthen diplomatic and political relationships. The United States appears determined to challenge that influence. Cuba's medical mission has undoubtedly saved thousands of lives and provided vital healthcare services to countries that desperately need them. At the same time, it also expands Cuba's international influence and diplomatic reach. Likewise, U.S. concerns may involve both human rights issues and broader economic and strategic competition. Ultimately, the question remains, is Cuba's medical mission a blessing for developing nations, or is it a tool in a larger geopolitical game? What do you think? Share your opinion in the comments below, and if you enjoy in-depth analysis of global affairs, geopolitics, and international relations, don't forget to like, share, and subscribe. Thanks for watching, and I'll see you in the next video.